Welcome everyone to the Clinician Training Session. My name is Dehlin and I'm the Senior Director of Clinical Services for Hospi, the maker of the Macy Catheter. Organizations across the country have committed to investing in a new initiative that will enhance patient comfort and improve the lives of patients and families, all while making your job more efficient and more rewarding. Let's get started with a preview of what we'll cover during today's session. You'll learn what the Macy Catheter is and why your organization chose this as a new or refreshed initiative. We'll walk through both how and when to use the Macy Catheter, as well as why the device is so effective. We'll also spend some time reviewing how to introduce the benefits of the Macy Catheter to patients and families. Your organization has defined parameters to guide you regarding when to use the catheter, so we'll spend some time talking about those common triggers as well. We'll also make sure you leave this training with the resources you need for a successful implementation. Finally, we'll make sure you're equipped to identify a patient and place the catheter immediately and with confidence. The Macy Catheter, simply stated, is a medical device used to administer medications and fluids rectally. It's a transformative product that will change the way you palliate symptoms in your patients. Your organization's leadership recognizes the multiple benefits of the Macy Catheter to improve palliation, reduce revocations, and increase quality. As a general overview, the Macy Catheter allows for immediate utilization of medications that you already have in the home or at the bedside. Oral tablets or liquids like the ones found in comfort kits can be administered through the Macy Catheter with little or no lag time in managing symptoms. And the Macy Catheter is very discreet and comfortable. And after the initial insertion, which is painless, the catheter can be accessed by clinicians and caregivers without turning or moving the patient. And because it's so easy for families and caregivers to use, the patient can remain in the home or wherever he or she is most comfortable. The picture you're seeing to the right is the Macy Catheter kit. It includes a Macy catheter, lubricant, gloves, syringes, a securement device, and a system for liquefying oral medications. The Macy Catheter was invented by former hospice nurse and now president of our company, Brad Macy. He did so from a need to quickly palliate symptoms using the oral medications already at the bedside. The Macy Catheter is FDA cleared to provide rectal access for administration of both medications and liquids. It does require an MD or NP order, and it can remain in place for up to 28 days. Now, since the catheter entails a non-sterile placement, it can be cleaned and reinserted should it be expelled with a bowel movement, as it's designed to do. The initial placement must be done by a licensed nurse, but subsequent placements and medication administration can both be done by caregivers. Displayed in the diagram to the right is the rectal vault and its surrounding structures. You can see that the Macy Catheter is positioned at the distal third of the rectal vault, and the balloon is inflated just above the rectal sphincter. The rectal vault is very vascular, even at the end of life, and it contains a large number of absorptive cells in the lining. So why is this significant? Well, patients at the end of life have less or non-existent intake, and they're often dehydrated due to the nature of the disease process. And this creates a dry environment in the rectal vault. Additionally, patients often have secretions, so we're administering drying agents like anticholinergics to alleviate that symptom. Now, these agents and nearly every other medication we're giving at the end of life further dries the rectal vault. We also know that at the end of life, blood is shunning to the core and away from the extremities. The reduced reservoir of blood in the extremities can make sub-Q injections much less effective and variable. However, when medications are crushed and mixed with water to make a suspension, which we call a microenema, and then administered directly into the dry rectal vault, medication absorption is rapid and it's effective. Now, with that information, it makes sense that the traditional practice of inserting a tablet or even sometimes a suppository directly into the rectum is ineffective. It's too dry to adequately absorb or dissolve the medication. Instead, with the Macy catheter, the 10 ml suspension of water and medication is absorbed like it was applied to a dry sponge, and the medication readily enters into the circulatory system via the highly vascularized mucosal tissues. In fact, patients and nurses report that the effects of medications are felt within 10 to 15 minutes. As we think about the most common drug classifications used in hospice and palliative care, the rectal route is significantly more versatile than sub-Q, IV, sublingual, or other routes. Looking at the chart, you see that there are medication options in every drug classification via the rectal route, while the alternatives have far greater limitations. Extended release tabs or any medication that generally cannot be crushed are exceptions and should not be administered using the Macy catheter. The Macy catheter allows the prescriber to customize the medication regime that are most effective for individual patients. For example, some drugs, such as dexamethasone, antidepressants, or anticonvulsants, may cause a high symptom burden if abruptly discontinued. Fortunately, they can be readily administered via the Macy catheter. Now let's talk about exactly how to use the Macy catheter. Applying the Macy catheter is super simple, and it's accomplished in 4 quick steps. Lubricate and insert the catheter, inflate the balloon, and then secure the port. The Macy catheter comes in a bedside kit that includes everything needed for quick insertion and subsequent medication administration, and it's latex-free. It's ordered from your regular medical supply company. The kits are not affected by extreme temperatures, so feel free to carry it in your trunk, and it has a shelf life of 3 years. There are 2 sets of instructions. One set, called the Macy Catheter Bedside Care Kit Instruction Manual, which is in large print, was created as a resource for the caregiver and should remain in the home. It contains pictorial instructions useful if the caregiver does not read English. The set called Macy Catheter Instructions for Use, which is small print, was created for the licensed clinician that will be inserting the Macy catheter. The kit includes medication sheets that can be used by caregivers at the discretion of your organization, as well as 2 small containers with adapter lids. These containers, along with the syringes, will be used to create the medication suspension. Together, they're called the LiquiPill system. Now let's zoom into the components of the Macy catheter itself. In the forefront of the picture, you'll see 2 ports. The purple port clearly says meds, and this port can only be accessed using an integral tip syringe. The red port is the balloon inflation port and can only be accessed using a lure lock syringe. This design was developed with caregivers in mind. It prevents the accidental administration of medications into the balloon port. The red balloon port also reads inflate with 15 mils to make reinsertion for caregivers simple. As you follow the catheter tubing down towards the balloon, you'll see 2 blue arrows with a blue line in between. The catheter should be inserted until the blue line is visible just outside of the patient's body. Now, below the placement marker lines, you'll see the inflated balloon. It's about the size of a quarter and it's very soft, and it's designed to be expelled easily with a bowel movement. The 4 holes seen at the distal end of the catheter, 2 on each side, are designed for the medication suspension to be dispersed uniformly into the distal portion of the rectal vault. I'd like to introduce you to Morgan, who will walk you through the quick and easy 2-minute catheter insertion procedure.
Inserting the catheter is much like inserting a urinary catheter, only easier, faster, and is a non-sterile technique. Insertion usually takes 3 minutes or less. First, lubricate the distal end of the catheter to the first arrow. Second, positioning the patient on the side or in supine position with knees bent, insert the catheter to the line between the 2 arrows. Third, remove the red safety cap and inflate the balloon to 15 ml using 15 ml of room temperature or cool tap water. Fourth, tug gently to assure the catheter is snug against the inner portion of the rectal sphincter. Finally, secure the catheter by running it between the patient's legs and securing to the thigh or lower abdomen. Administering medications through the Macy catheter is a simple 3-step procedure: draw, inject, and quick flush. If medications are already in liquid form, they can simply be drawn up using the 10 ml enteral syringe provided in the kit and administered via the medication administration port. Medication should be administered over 3 to 5 seconds. 1, 2, 3, 4, 5. Some kits contain another Hospi product, the LiquiPill system, to help prepare medication suspensions. Once medications have been administered, please follow with a 3 ml quick flush of tap water. This quick flush should be administered in less than 1 second. 1. If the catheter is not properly quick flushed, on rare occasion there may be leakage from the medication administration port. To solve this, please inject another 3 ml using the 3 ml enteral syringe of tap water and inject over less than 1 second. 1. This should correct the situation. That's all there is to Macy catheter insertion and medication administration. For more information, please visit macycatheter.com. Thank you so much for your time.
Once the Macy catheter is inserted, you'll utilize the LiquiPill system, which is included in the kit, to crush medication and suspend them in a water solution. Morgan will show you here.
Taking the tablet that you would like to crush, you simply put it in one of the 2 slotted openings. Second, simply move the grinder back and forth like a pepper mill to crush the medication into a fine powder. The grinder is very easy to move back and forth and was designed with caregivers of all ages in mind. You will know the medication is completely ground because the grinder gets smooth and quiet. And as you can see here, the medication has been ground into a really fine powder. So now you're ready to add a little bit of water. Taking your 10 ml enteral syringe, you'll put it on top of the syringe adapter cap. I just put in room temperature tap water into this water receptacle. I'm going to pull back 10 ml of the tap water and simply put it on top of the medication reservoir and inject. Next, I'll just swish and swirl for about 10 seconds. This makes sure that the medication is fully in suspension form as you get ready to give it via the Macy catheter. So next, you'll draw up the 10 ml suspension, and you're ready to administer via the Macy catheter. It is important to note that you will want to have a 3 ml quick flush to follow that to make sure that all the medication gets through the Macy catheter. That's all there is to utilizing our LiquiPill system. For more information, please visit macycatheter.com. Thank you so much for your time.
Limiting the number of pills that you suspend in a 10 ml solution to 4 large pills or the equivalent, and then shaking and swishing for 10 seconds will keep the catheter patent and free of sediment. If you need to administer more than 4 large pills, then prepare a second solution to give following the first, and then always follow with a quick flush. Just like any device, knowing how to care for it and maintain its function is important. Routine pericare may be performed with the Macy catheter in place, cleaning the tube as you would any other body part. Although infrequent, if the medication port leaks, just repeat a 3 ml quick flush. If you notice leakage from the rectum, check to be sure the placement marker lines are in position and that the balloon is inflated to 15 ml. Teaching the caregiver to give the suspension immediately will also reduce the accumulation of sediment in the syringe and prevent leakage from the port. Now that you see how quick and simple the procedure is, let's talk about how to identify which patients are appropriate for a Macy catheter evaluation. Prior to this training, your clinical leadership developed a unique set of parameters or protocols in order to provide quicker, more effective symptom relief for patients, to reduce the time and frequency of symptom management visits, to reduce revocations, and to improve caregiver satisfaction. You should always keep an electronic or paper copy of the parameters or guidelines with you for reference. Your task is to use these guidelines to properly identify the patients that will benefit from the placement of a Macy catheter. With these parameters in mind, let's review a few real-life scenarios that you'll commonly encounter with hospice patients. About 20% of hospice patients will experience severe symptoms at some point in their care, meaning they would rate any symptom, such as pain, agitation, nausea, dyspnea, or even seizures, as a 7 or higher on a 10-point scale. Now, these are patients in crisis who need immediate relief. Placing a Macy catheter in these patients is an effective, quick, reactive approach to managing symptoms. Sometimes you can anticipate patients that may experience this level of crisis, and you can place a Macy catheter proactively to prevent those severe symptoms. An example might be a patient with dementia that requires scheduled oral doses of antipsychotics to reduce agitation, and that patient now has reduced intake and an ability to swallow. Maintaining the antipsychotic regime via the Macy catheter will prevent a symptom crisis related to agitation. Most of the time, patients with mild or moderate symptoms can be managed with oral or sublingual medication routes. However, if the volume of the medication is too much for effective sublingual absorption, or if the patient has heavy secretions, then using the Macy catheter is the logical alternative. Occasionally in hospice, patients or families benefit from gentle rehydration. If hydration is indicated, the Macy catheter is an excellent choice. Up to 2 liters of water or Pedialyte per day can be administered depending on the patient, either via bolus doses or continuously using a kangaroo bag. The process of administering fluids via the rectal route is called proctoclysis, and there's more detailed instructions on our website and in your policy and procedure. The more you use the Macy catheter, the easier it is to recognize when a patient will benefit from it. Until then, consider using tools that you already have in place to trigger the use of the catheter, such as when a PPS score drops, or when you need to titrate doses up more than once in a day, or when you place your patient on your daily or imminent list. By using these parameters for patient selection, you contribute to the patient comfort, family empowerment, organizational quality, and your effectiveness as a hospice clinician. Prior to the initial insertion of any Macy catheter, the nurse must ensure that the patient doesn't have any contraindications. Now, these include rectal lesions or tumors, active rectal bleeding, which does not include bleeding due to hemorrhoids, and recent bowel surgery within the previous 6 weeks. Diarrhea is a precaution. While it's not a contraindication, copious diarrhea may result in repeated expulsion of the catheter and reduced medication absorption. If an impaction is detected during the digital exam, or if there's a large amount of stool in the rectal vault, you should follow your organization's protocol and physician orders for disimpaction. If the impaction or stool is high in the rectal vault, insertion of the Macy catheter can proceed. Even though the rectal route has been used for decades by hospice clinicians, introducing a rectal catheter to patients and families must be done so with care, compassion, and dignity. Teaching the benefits of a new standard of care, such as the Macy catheter, is the strong suit of most hospice clinicians, as the comfort of the patient always comes first. Think about the teaching in 3 steps. Identify the why, or the trigger for considering the Macy catheter. What is the symptom that needs relief? Or what is the symptom that you want to prevent? For example, you might say, your mom is becoming more restless, and the medicines we're giving her in her cheek are no longer effective. Another example is, your dad's breathing is still really labored, even though we're giving large doses of oral medicines. Now, these statements are quickly followed by a reassuring statement that sounds something like, but we have a solution. There's a way to control the agitation or the pain or the nausea without a needle, and I can do it right here, right now, really quickly. Finally, you'll educate on how you'll accomplish this in step 3. We have a very small, very flexible catheter that is inserted painlessly into the rectum and delivers the medications for quick absorption. And since the catheter can stay in place, you can access the ports and give medicines without exposing or moving your dad. I know dignity is important for your dad, and this catheter provides relief and dignity at the same time. Every family's number one goal is to alleviate and/or prevent suffering. So overcoming the potential barrier to the rectal stigma is simple when the benefits are correctly conveyed. The more experiences you have with the Macy catheter, the less you'll need to refer to the next two slides. Until then, use these teaching points as you introduce the benefits of the device to patients and families. The rectal route can be used to administer a wide variety of medications, including the medications that the patient already has at the bedside, which facilitates rapid symptom management. The catheter is comfortable, it's smaller and softer than formed stool already in the rectum. In fact, many patients report that they don't even realize it's in place. The patient doesn't need to be stuck with a needle or taste bitter oral liquids. If desired, the patient can move freely and continue with activities of daily living as the extremities are unencumbered. Medications usually work more quickly and more effectively when administered via this route. The insertion of the catheter is painless and takes only minutes. It can remain in the rectum for up to 28 days, and if it is removed for or expelled by defecation, the catheter can be immediately cleaned with soap and water and reinserted. We found that occasionally the patient or family can also benefit from a more formal introduction of the Macy catheter. I'll show a short clip from this video that was created to provide patients and families with information on what to expect. We encourage each of you to download this video from our website, macycatheter.com, to your mobile device so that you can access it for patients at their bedside.
Until now, the rectal route has been associated with a lack of privacy and discomfort from repeated insertion of suppositories. The Macy catheter, a new option for giving medications rectally, was designed with these concerns in mind. The small, soft Macy catheter allows the patient to receive medications when they cannot take them by mouth. Quickly and easily placed by your nurse, the Macy catheter is held in place with a very small balloon inflated after insertion. The medication port is secured to the thigh or abdomen. The catheter is completely comfortable, and it can stay in place for ongoing delivery of medication. The caregiver does not have to move or bother a sleeping patient when giving medicine.
As you can see, the Macy catheter is an amazing tool to carry in your bag, but it's so much more than that. The device is an organizational initiative implemented to meet the identified objectives and to elevate patient care. It's more than an option. It's now an expected standard of care within your organization. For some, change is welcome. For others, it's avoided. But for the sake of the patient, it's a constant need. It's not often that hospice clinicians are presented with new technology that so dramatically improves patient suffering. That's because many of our best practices have been around for years. It'll take some time and intentional effort on your part to hardwire this improved standard of care. To socialize the concept among the entire team, talk about the patient indicators in your morning huddle. Share feedback on your recent experiences during interdisciplinary team meetings, and prep on-call nurses for any potential needs. Documenting the insertion in the medical record and incorporating the Macy catheter into the plan of care is required. Your supervisor can give you more details on where and how to do that within your EMR. Be sure to add it to the hospice aid assignment and get orders to change the medication routes as well. Your managers will be monitoring the ongoing use of the Macy catheters within your organization, so please let them know about your successes. As you venture out into the field, keep in mind that Hospi has developed multiple resources for you, for patients, and for patients' families. A clinical team member is available 24 hours a day on our toll-free number listed here. If you have a question that's not urgent, you can email us. If you prefer to chat with a live Hospi RN, you can access that function on our website at macycatheter.com. On the website, you'll also find additional resources like training videos, publications, testimonials, and frequently asked questions. You can also log into Relias Learning Platform via the Hospi Academy tab on MacyCatheter.com to access CE courses, many of which are free to you as a Macy Catheter client. You'll also find a plethora of what we call Macy Moments on MacyCatheter.com. Macy Moments are testimonials that describe the moment when the light bulb turned on for them and the success stories that went along with it. Our team hears it over and over again. It only takes one time to get it. So where do we go from here? What does this look like in real practice? First, look back at your organization's parameters. Keep them with you to reference and think about your current patients that might fit into these parameters right now. Are the patients you're thinking of carrying a heavy, albeit managed, symptom burden? Are they already experiencing a symptom crisis? Or are they at high risk for developing heavy symptom burdens? Second, acknowledge that this is a new standard of practice in hospice and palliative care and that your patients deserve the most effective and comfortable intervention available to alleviate or prevent suffering. Third, know when and where to get your kits. Fourth, seek out hands-on competency or return demonstration if needed. Fifth, be confident when introducing the Macy Catheter to patients and families. They trust you to make the best recommendations for them at the right time. Sixth, report the successes you experienced with the Macy Catheter back to your team. If there are any obstacles, talk them through with your team as well. Remember, none of this matters until you identify your first patient, and it's likely that each of you has at least one right now that you're thinking of. Remember, change is hard for many people, even good changes. Support each other, reach out to us as often as needed, and find your first Macy moment. We can't wait to hear about it.